Leukotriene inhibitors. Leukotriene inhibiting drugs include Singulair, Aculate, and Zyflo. Leukotriene inhibitors work by blocking the action of leukotrienes. Leukotrienes cause the constriction of muscles in the airway and cause excess mucus secretions. Therefore, leukotriene inhibitors prevent excess constriction of the airway and hyperproduction of mucus secretions. Singulair, Aculate, Zyflo are indicated for the treatment of asthma. Singulair is the only leukotriene inhibitor approved to treat allergies, allergic rhinitis, and allergic conjunctivitis. Singulair inhibits the cystenyl leukotriene receptor, which is correlated with the pathophysiology of asthma, which includes airway edema, smooth muscle contraction, and the inflammatory process. Aculate, selectively and competitive leukotriene receptor antagonist of leukotriene D4 and E4, which are components of slow-reacting substance of anaphylaxis. Zyflo is a specific 5-lipooxygenase inhibitor, which inhibits leukotriene formation. Pharmacodynamics. Singulair, Aculate, and Zyflo are all rapidly absorbed. Here is a slide with the distribution of Singulair, Aculate, and Zyflo. Singulair is extensively hepatic via CYP 3A4, 2C8, and 2C9. Aculate is extensively hepatic via CYP 2C9, and Zyflo is hepatic and gastrointestinal and can be metabolized by CYP 1A2, 2C9, and 3A4. Singulair is excreted primarily in the feces. Aculate is also excreted primarily in the feces, and Zyflo is excreted primarily in the urine as metabolites. Precautions. Singulair can cause eosinophilia and vasculitis, also can cause neuropsychiatric events. Aculate can cause eosinophilia and vasculitis, an increase in infections, and hepatotoxicity, so liver function tests are needed. Zyflo, you monitor for behavioral changes and sleep disorders, hepatotoxicity, so you would also need liver function tests with this drug, and can potentiate the effects of sedatives or alcohol. None of the above drugs are indicated for the reversal of bronchospasm with acute asthma attacks, including status asthmaticus. Singulair, Aculate, and Zyflo are all contraindicated when there's a hypersensitivity to any of these drugs. Aculate is also contraindicated with hepatic impairment, and Zyflo is contraindicated with acute liver disease. Adverse drug reactions for Singulair occur in 1 to 10% of those using the medications. Common adverse reactions can include headache, dizziness, abdominal pain, and other symptoms. With Aculate, greater than 10% experience a headache, less than 10% experience dizziness, pain, nausea, diarrhea, as well as other symptoms. With Zyflo, 25% experience a headache, and less than 10% experience dizziness, chest pain, drowsiness, and other symptoms. Here's a list of the potential drug interactions with each of the leukotriene inhibitors. Indications for clinical use. These drugs are used for the treatment in asthma, allergies, allergic rhinitis, and allergic conjunctivitis. Leukotriene inhibitors are effective in treating asthma and certain allergic occurrences. There's a limited incidence of adverse drug reactions, and they're known for affordability and availability. For patient education, leukotriene inhibitors can be taken on an empty stomach. Monitor for signs of liver problems, which can include dark urine, feeling tired, loss of appetite, stomach pain, yellowing of the skin or eyes. It may take a few days to see the effects of the drug when you start taking this medication. Leukotriene inhibitors are not rescue drugs, and you need to go over a list of the medications that you take with your provider to avoid unsafe drug interactions. The main takeaways are that leukotriene inhibitors are not to be used as rescue medications for acute asthma attacks. Monitor liver function when prescribing, and although rare, neuropsychiatric events can occur. Know that the most common side effect with these drugs is headaches. Thank you.